So today we're diving into a condition called aplastic anemia. It's pretty rare, but it's also incredibly serious. And it forces us to ask a really fundamental question. What happens when one of your body's most essential systems just shuts down? I want you to imagine a factory inside your body. It's running 24/7, just churning out 3 products that are absolutely critical for you to stay alive. Now, what if that factory, with zero warning, just went dark? That right there, in a nutshell, is what happens in aplastic anemia. All right, so to really get what's going on, we have to think like medical detectives. Our first move? We're heading straight to the scene of the crime to figure out what exactly has gone so wrong inside this factory.
So, this factory keep talking about? It's your bone marrow. This is where all the magic happens, where special stem cells create every single one of your red cells, white cells, and platelets. But in aplastic anemia, this factory doesn't just slow down. It becomes hypocellular, which is just a fancy way of saying it's mostly empty, taken over by fat. The production lines have gone completely silent.
And the fallout from this shutdown? Well, it's immediate and it is absolutely devastating. When you stop making red blood cells, you get severe anemia, which leads to this crushing fatigue. When you stop making white blood cells, your body's entire defense system just collapses, leaving you wide open to all sorts of nasty infections. And without platelets, you can't form clots, which means you start bruising easily and can have really dangerous bleeding.
Okay, so we know the factory has failed. The next huge question for our investigation is why? Who or what is actually responsible for this shutdown? Turns out we're usually looking for one of 3 main culprits.
Believe it or not, in most cases, this is an inside job. The body's own immune system, specifically its T cells, gets its signals crossed and launches a massive attack on the stem cells in the bone marrow. It's a classic case of friendly fire, and it's brutally effective at shutting down production. The second possibility is more of an external attack. You can think of this as straight-up industrial sabotage. Certain chemicals, like benzene, really high doses of radiation, or even some specific medications can act like a poison, directly wiping out the stem cells and grinding the factory to a halt from the outside.
And finally, sometimes the problem is baked right into the system from the start, a fundamental design flaw. There are inherited conditions, like Fanconi anemia, that mean the factory was basically built with faulty blueprints. The stem cells have these defects in their DNA repair kits, which causes them to fail over time.
So now that we have our list of suspects, how do doctors in the real world actually confirm what's going on? Well, they follow a very specific diagnostic blueprint to crack the case. Let's make this real. Let's look at a case. We've got a 25-year-old woman who shows up with symptoms that sound awfully familiar, right? Severe fatigue from anemia, frequent nosebleeds from low platelets, and a fever, which is a huge red flag for an infection because of low white cells. The investigation begins.
Doctors follow this really logical path. First, a simple blood test, a CBC, confirms their suspicion. All 3 of her cell lines are dangerously low. This is called pancytopenia. Next, they look at her blood under a microscope to make sure it's not something that can look similar, like leukemia. Then, and this is a key clue, they check the number of new red blood cells being made. A really low count here tells them, yep, this is a production problem. After ruling out a few other causes, there's really only one place left to look.
And here's a subtle but brilliant piece of detective work that happens during the physical exam. In aplastic anemia, the patient's spleen isn't enlarged. Now, why on earth does that matter? Well, because in a lot of other diseases that cause low blood counts, the spleen gets bigger because it's working overtime trying to filter things out. A normal-sized spleen is this powerful little clue that points the finger directly away from other organs and right back at that bone marrow factory. And this is the aha moment. The bone marrow biopsy is the final undeniable piece of the puzzle. The pathologist looks at that sample and they see exactly what we've been talking about, a barren, empty marrow where almost all the working tissue has been replaced by fat. Case closed. And to put a hard number on that, severe aplastic anemia is often defined by the marrow having less than 25% cellularity. Just think about that. That means over 3/4 of what should be a bustling factory floor is just empty. This number is so important because it tells doctors just how serious the situation is and helps guide what to do next.
Okay, so the diagnosis is confirmed. The detective work is done. Now the focus shifts immediately to action. How in the world do you restart a factory that's completely failed? Well, it really comes down to two main strategies, two very different paths to recovery.
So which path you take really depends on the patient's age and if you can find a donor. The first option is basically a total factory replacement, a stem cell transplant. This is the best shot at a cure, but it's a very intense process, so it's best for younger patients who have a perfectly matched donor. If that's not in the cards, the goal changes. You're not replacing the factory, you're trying to fix the one you have. And you do that with something called immunosuppressive therapy, or IST. This treatment is designed to call off that internal immune attack, giving the patient's own stem cells a fighting chance to recover and get back to work.
And you can see just how well this modern IST approach works in this timeline. Here we have a 32-year-old man diagnosed with severe aplastic anemia. They can't find a matched donor for him, so he starts on this powerful cocktail of immunosuppressive drugs. It takes a little time, but look, within a couple of months, his own marrow factory starts to reboot. And by month 4, he doesn't even need transfusions anymore. It's just an amazing testament to how effective this therapy can be.
Now, while waiting for these big gun treatments to work, you have to keep the patient safe. That's where supportive care comes in. It's the bridge that gets them through. This means being super aggressive with antibiotics at the first sign of a fever, giving red cell and platelet transfusions where needed, and just generally protecting them from anything that could further harm their fragile bone marrow.
So we've seen the factory fail, we've identified the culprits, cracked the case, and even started the repairs. So, what's next? What does the future actually hold? What is life like on the other side of this diagnosis?
This right here might be the most hopeful part of this entire story. Before we had these modern treatments, severe aplastic anemia was often a death sentence. Most people didn't survive more than a year or two. But today, with transplants and advanced immunosuppressive therapy, the whole picture has been transformed. For many patients, long-term survival isn't just a possibility, it's the expectation.
But getting better doesn't mean the journey is over. Recovery really requires lifelong vigilance. Patients need to be monitored for any chance of a relapse or other potential complications down the road. It's not about being cured and walking away. It becomes a managed condition, a partnership with their medical team for life.
And, that really brings us to a final thought. The story of aplastic anemia tells us something so fundamental about our own bodies. Our health, our very lives depend on these silent, invisible, microscopic factories running perfectly every single second of every single day. It's a pretty stark reminder of just how fragile that whole system can be. But also, thanks to modern medicine, it's an incredible testament to how resilient we are and to our amazing capacity to recover.